So the next question is the patient's perspective, and that's Kirah Fasano. It's not on.
On? Okay. Hi, everybody. My name is Kirah Fasano. I'm 32 years old. I have chronic progressive ophthalmoplegia, otherwise known as CPEO. I was first diagnosed with ptosis of my left eye at 17. It was kind of sudden. I mean, it was like you wake up one day and you really can't open your eye. I was tested for myasthenia gravis, which I did not have. And they basically said they don't know what's causing it, but they can do a corrective surgery to lift it up and stabilize it. So I had that done and kind of went about my teenage life. Finished high school, went to college, continued all my activities. I was very active in dance. I danced professionally in ballet. I ran track. I worked out like any other early 20-something-year-old female, and it really wasn't until about 23 or 24, after I had my wisdom teeth out, I started noticing some facial weakness, and that just kind of bothered me. And again, a lot of doctors said, "Oh, I don't know, it might just be something small, don't worry about it." So I went about my business, and it wasn't about until 25 years old I started noticing I couldn't exercise like I had always done. I was always winded, always exhausted, always very sore the next day when I didn't really even do what I thought was much of anything. And then by the age of 27, I finally went to see a neurologist who immediately said, you've got a mitochondrial disease. You have chronic progressive external ophthalmoplegia. At which point my life kind of got turned upside down. Then that was May of 2010. So this was a 10-year span of kind of not really knowing what was going on. Once I did find out, then, there's a lot of testing, genetic testing, and finding out what to do about it, which you all know is a lot of nothing. I was also engaged to be married at the time, and we were worried about having children. Would this affect the children, and what was our risk? So we met with several genetic counselors, and it brought us to Dr. Falk, who helped us kind of just go for it. We decided to try after we got married, and we were not successful conceiving for the first year of trying. So we saw specialists, and after 3 years, nothing happened. We started all of the assisted reproductive meds and procedures, and they just never found anything that was specifically wrong. So then that led us to IVF. We did IVF for about 4 rounds, and at that point we had still not ever gotten pregnant. And what they found was my eggs appeared normal. They would start to divide, and then they would just sort of stop. And they didn't really know why, whether it was, my reproductive endocrinologist just call it, unexplained infertility at this point, because they can't really pinpoint it. But they wonder, given my mitochondrial disease diagnosis, if that had something to do with it. But the eggs were never tested. So we had options, which were to continue fertility treatments and, testing the eggs and doing all of that, which, of course, as you could imagine, at that point was emotionally very difficult to continue. Because when you're infertile and you're going through all of this, the women get kind of grouped into two groups. There's the women that have gotten pregnant with treatment, but then they miscarry and they have lots of losses, and then there's the people that never get pregnant. And in the two groups, the people that never get pregnant are kind of, I don't want to say worse off, but they're in their own category at this level of treatment. And so we weren't too optimistic that continuing treatment was really going to help. So then there's always the option of you just live child-free, and there's nothing wrong with that. And there's lots of upsides to that, actually, vacations and dinners and freedom that a lot of people with children don't get to experience for a while, maybe until the kids go to college. And then there's also adoption, which we really considered heavily, but we decided was not for us after attending several support groups. A lot of people when they hear that you're infertile, they'll say, oh, just adopt a kid. Oh, it's just easy to go pick one out. Like you just show up at an orphanage and you just pick up the cutest one and you can walk out. And it's not like that. There's a lot of state laws, and they're all geared towards protecting the rights of the birth mother and that child, and the birth father and that child. There is nothing to protect the adoptive parent legally. And in our support group, a lot of the women who were going through the adoptive process or were veterans, I guess, of the process, would give advice to new people coming into the group as far as if they thought it was worth it, now that they've been through it all. And almost all of them said no. They would have tried something different, but now they can't afford to because they've put out so much money in the adoption process, and you're not guaranteed anything. So we're women with rooms in their house ready for baby, nurseries, no baby in sight because either the birth mother changed her mind at the last minute or it fell through, XYZ. But at the end of the day, you still pay for all of that. You've still paid for your services, you've still paid for the lawyer and the social workers to come out, and you still have gotten everything ready. And now you're still, childless not by choice. So we decided that we probably could not handle the rejection of the adoption process after going through the infertility process, and then after going through, my mitochondrial disease diagnosis. We just could not weather that storm. So we decided to look into egg donor. We went to support groups for that, and it seemed very promising that at the end of the day, it was just a child that for us to love, and it was our child. Whether the DNA was my DNA or not, it would still be my child. I would carry it, I would labor it, I would hold it in my arms on day one. And that meant more to me than just being a parent. Because again, sometimes everyone just focuses on the being a parent and all of the stuff that goes with it after you get the child. But for a woman, sometimes it's really important to feel like it's not just that it has your DNA; it's that you've carried it. You've nurtured it. It's yours, and it was just really important to me. And it was actually ended up being cheaper than the adoptive process, which was also, which was very nice. The egg donor process also, it seemed they screen out a lot of the major genetic diseases, that you have to worry about. So I felt like we were getting a healthy egg versus in the adoptive process, you don't really know what you're getting. You don't know how the mother was taking care of herself before, during, the pregnancy. And you don't really get always a background of their family. So at least with egg donor, you will get to look kind of at their family tree a little bit, genetically. The biggest concern we have, of course, is that we will have to tell our child, of her origins and deal with that. But I'm sure, that's just like any parent who adopts a child. You have to explain how they got there. And we're hoping that it's not as bad as we think it is right now. But with, lots of children being born by IVF and other therapies, we're hoping that it's not going to be as horrible when she finds out. But I think that, MRT was exactly what we would have been looking for. PGD was not an option for us because of my type of mitochondrial disease. It did not meet the qualifications. So, for people like me who you can't really do PGD, this might be the only other option to have a genetically linked child. And I guess I see the little red light, so I'll just stop there.
Thank you.